Hello everyone and welcome. Let's go ahead and get started. We're going to be discussing Chapter 7, which is Sexually Transmitted Infections. I hope you all have read the chapters and have come prepared. The goal of today's class is to gain a basic understanding of STIs, signs, symptoms, and treatment. We're going to define the term STI. We're going to review the current trends, classify the different types of STIs, and once we're completed with that, we're going to do a case study and some polling questions. The term sexually transmitted infection replaces the old term sexually transmitted disease. It is an infectious disease syndrome primarily transmitted by close intimate contact, including vaginal, anal, and oral sex, and some can even be spread through blood products. Every year, 50% of all new STIs are acquired by Americans ages 15 to 24. When you think in terms of STIs, think in terms of bacterial. You have chlamydia, gonorrhea, trichomonas, and syphilis, and viral. Hepatitis B, herpes simplex virus, human papillomavirus, and HIV are the most common. Bacteria can be cured with antibiotics. Viral infections cannot, so those STIs the person has for the rest of their life. Every year, more than 500 million people are estimated to have genital herpes. That is approximately 16% of the population. 90% of the population has been exposed to have HSV type 1. Some of these patients do not even know they have herpes because they've never had an outbreak. In fact, many of your STIs do not have signs or symptoms, and if they are not treated, a lot of these patients can have major health consequences. So let's discuss bacterial STIs first. Chlamydia is the most common reported bacterial STI in the United States, with peak incidence in females aged 15 to 24. Many of these patients will present to your clinic not even knowing they've been exposed or have chlamydia. If they do have symptoms, these can include cervical discharge, abnormal vaginal bleeding, or dysuria. We diagnose by culture of urine or genital, either cervical or urethral. Once a diagnosis is confirmed, we treat with antibiotics, either it was azithromycin or doxycycline, and I usually do treat the partner as well. Gonorrhea, like chlamydia, is a major cause of cervicitis and pelvic inflammatory disease. Again, a lot of your patients are asymptomatic. The CDC recommends screening all sexually active females ages 15 to 24, as well as high-risk populations. Screening is done with culture of either the urine or genitalia. Once a diagnosis is made, we treat with Rocephin, 250 milligrams, plus your azithromycin because of the drug resistance. Pelvic inflammatory disease is a result of an ascending infection. Starts at the cervix, progresses to the uterus, and can be into the tubes and then eventually into the abdomen. Gonorrhea and chlamydia are the most common bacteria that causes infection. However, there is other bacteria that causes infection as well. There's not one single test for PID. It is based on clinical findings and physical findings and clinical history. Some of your physical findings include urine adnexal tenderness, cervical motion tenderness, vaginal discharge, and fever, as well as pelvic pain. We want to do a culture for gonorrhea and chlamydia. Once a diagnosis is confirmed, we treat either inpatient in the hospital with IV antibiotics or outpatient. And that depends on how severe the infection is. So say it's led to a tubal ovarian abscess, perihepatitis, or pelvic peritonitis, then we usually will hospitalize that patient and treat with IV antibiotics. Outpatient treatment includes 1 shot of Rocephin, doxycycline, as well as your flagyl. Moving along to syphilis, the hallmark of syphilis is your painless chancre at the genitalia with a smooth base and raised borders, and this usually occurs in the first stage. There's 3 stages of syphilis. The secondary stage includes more systemic symptoms, which includes skin rash, lymph nodes, swollen lymph nodes, and fever. If not treated at this point, it can lead to a tertiary syphilis, which can include destruction of the central nervous system. Diagnosis is a blood test. RPR is what we use at the clinic. We recommend treatment for all pregnant women in penicillin 1 gram, or penicillin IM single dose is your treatment. Here's some other bacterial STIs I want you guys to be familiar with, and they are in your textbook. We're going to switch now to discuss viral STIs, and we're going to start off with herpes. We know that can be caused by either type 1 or type 2. Type 1 is primarily your oral sores, and type 2 is primarily your genital. However, they both can be transmitted to other sites. Patients will present in severe pain. They will have painful ulcerations, fevers, chills, malaise, and severe dysuria. These patients often say, I need to be worked in. I have the worst yeast infection ever. I need to be worked in. I have the worst UTI ever. You do a genital exam, and then you see the ulcerations. At that point, you will take a culture at the base of the lesion. And then once a diagnosis is confirmed, you treat with your antivirals. We want to counsel that this infection will not be resolved. It will be with the patient for the rest of their life. Prodromal effects usually occur with recurrent outbreaks. This is a numbness and tingling before the genital lesions erupt. At that point, we want to stop with sexual activity. And we also want to counsel that recurrent outbreaks can occur at times of infection, menstrual period, or times of stress. So we're going to move along now to the human papillomavirus. This can either be caused by your low-risk strands or high-risk strands. So say a person was exposed to a low-risk type, which is type 6 and 11, amongst other types. These can cause genital warts. If a patient was exposed to high-risk types, such as 16 and 18, this can lead to cervical dysplasia in the female, and up to 70% of cervical cancers are caused by the HPV high-risk strands. Diagnosis is made by either visual inspection and diagnosis and lesion by removal, or a pap smear. The CDC recommends pap smears of all women ages 21 to 65. Treatment depends on if it's genital warts or cervical dysplasia. Genital warts, we treat with a topical such as Aldera. Cervical dysplasia, we excise the dysplasia by cryotherapy or surgical excision. Hepatitis, we're going to go into more in depth in another lecture. However, I want to just review a few basic points. Hepatitis A is transmitted through a fecal-oral route, and vaccination is very effective. Hepatitis B is a disease of the liver. It is transmitted through semen and blood, and there isn't a vaccination for that as well. And hepatitis C, there is no vaccination, and it is a bloodborne infection. HIV, we're going to go into this in more depth at another lecture, but I want to discuss two things. Screening is done by the ELISA test. If positive twice, we confirm with Western blot. We offer testing early in pregnancy, and we also have a consent form signed before testing. I want to discuss a couple other STIs. Molluscum contagiosum is caused by the pox virus. It will spontaneously resolve within 6 to 9 months. Patients will have an outbreak of a flesh-cut lesion with a central umbilication. It is classified as an STI. However, daycare workers and other people can also be exposed just by contact. Trichomonas is caused by your flagellated protozoa. You will see this on wet prep. It is a motile protozoa. Most patients are asymptomatic. However, if they do have symptoms, it's usually a very malodorous discharge, vulvar irritation, and dyspareunia. We treat that with Flagyl single dose, and we do recommend that the partner be treated for that as well. All right, so now we're going to move on to our case study. I'm going to read it to you guys and just blurt out the answers when we get to the questions. You are an RN at the health clinic at your local university. After a culture was reviewed by the nurse practitioner, you call the 20-year-old female client to give her the results of the genital culture that is positive for HSV type 2. Acyclovir was called in for her. The female client is very upset and asks you the following questions. Number 1, will I ever be cured of HSV?
No.
That's right. No, you'll never be cured because it's viral, so your body has to clear it. She says, will I ever have any more outbreaks?
It's possible.
It is possible. We don't know that. Usually outbreaks occur with menstrual cycle, infection, or illness. Should she be tested for other STIs?
Yes.
Yes, she should. Where there's one STI, we assume that there's more, and she's also a 20-year-old female, so she falls in that age range where we want to test for other STIs. She wants to know when she can have sex again.
When the outbreak clears.
Yes, when it clears. That is the safest time. We do know that there's asymptomatic shedding, so I always recommend condoms. That's not always 100%, so you want to counsel on that, but you definitely don't want to have intercourse when there's open sores. And should she inform her sexual partner?
Definitely.
Yes. You want to make sure that she informs all of her sexual partners of her diagnosis. Okay, class, very good. Here's a copy of my references, and then we're going to move along to the polling questions. So I want you all to take out your cell phones because we're going to do some polling questions now. Okay, everyone have your cell phone ready. I'm going to read the question, and then you just text the response. In the United States, which of the following age groups has the highest prevalence of HPV infection? Everybody text your response. We'll see how the class did. Great. Right, that is so right. 20 to 24-year-olds. All right, so we're going to move along. The most common pathogens associated with PID are. Everyone text your question or your answers to the question. The most common pathogens associated with PID. Right, gonorrhea and chlamydia. There's other pathogens that can cause it, but those are the most common. Which of the following is the most consistent with the current CDC recommendations for screening for chlamydial infections? So who do you want to make sure you definitely screen for chlamydia infection? Right. Routine annual screening for all sexually active women under the age of 25 is the ones you want to screen, and that is very right. Which of the following best describes the signs and symptoms of trichomonas in women? What do you guys think that is? We discussed this earlier. So we know that trichomonas, like other STDs, can be asymptomatic. If they do, they have that frothy green discharge and vaginal discharge. Which of the following describes the most common clinical presentation of chlamydia, urethra in men? What do you guys think about that? Men and women are the same, so if they're asymptomatic, that is right. Great job, you guys. All right, that concludes our class today. I will be in my office or here after class to answer any of your questions. Keep reading your books, and we'll come back here next week. Thank you for being such a great class today.